let's talk about the scariest thing about surgery for femoroacetabular impingement. I'm Matt Shu from Upright Health, where we help you think right, move right, and feel right. If you're looking for more videos about hip impingement or how to help yourself with your hips, be sure to check out the description box for helpful links, and don't forget to subscribe. At Upright Health, we have helped a lot of people with FAI and labral tears. We have a program called the FAI Fix that has helped thousands of people around the world get their hips to feel better without surgery. And we also have clients that we've worked with who have already had surgery on their hips to correct FAI or labral tears. We get emails on a regular basis from people all around the world telling us about their experiences with surgery for hip impingement. And in this video, we're going to talk about the absolute scariest thing that I've gleaned from these conversations and these emails. First, the good news is that the surgery itself seems relatively safe. It's not like you're risking your life when you get hip surgery for FAI or a labral tear. It's nothing that dangerous. But here's the bad news for surgery for FAI. The surgery doesn't always work. So if you actually look at the research on success rates and satisfaction rates for surgery for FAI, you'll actually find that there are a lot of people who are disappointed by the surgery, especially if they're trying to get back into sports. And that brings us to the scariest part about surgery for FAI. You could be 3 months, 6 months, 9 months, 12 months, 18 months away from the surgery and still have the same pain in your hip. Or you might have pain that's moved or shifted to another part of your body. Or you may have the exact same pain but more intensely. Or maybe you have that pain but it's maybe 10% less than just before the surgery. And you go to the surgeon and you say, hey, my hip's not feeling good, or it seems like the pain's moved somewhere else. And then you get hit with this. Well, we fixed the bone problem, so if you still have pain, the cause is something else. Or you get hit with this. Well, we fixed the bone problem, so if it still hurts, it must be muscle. Or you get hit with this. Well, we fixed the bone problem, so from our perspective, it was a success. Or you get hit with this. Well, we fixed the bone problem, so maybe your pain would respond better to psychiatric care. I want to be clear that those examples are real life examples. Those are things that people have told us that surgeons said to them when surgery just didn't work. We have a couple of videos from clients of ours who had hip surgery and whose surgeons basically said, well, it still hurts, but tough cookies. And you can find their videos linked down in the description box below.
And I asked him kind of again, hey, I'm still having the issue of the exact same thing. And he told me, you passed the test. You can see me on an as needed basis. And so from that point, I decided I needed to look a little bit deeper at what other solutions might be out there.
Now, why do I think this is the scariest part of surgery for hip impingement? It's because it's basically pulling the rug out from under you. You go into the surgery with very high hopes, thinking you're about to get back to your normal life. And suddenly, the person who was supposed to fix you can't do anything, and you realize that they're actually not seeing success the same way you see it. And they're throwing back all of the responsibility on you, and sometimes suggesting that you might be crazy. That to me is a really frightening and disconcerting place to be. But the important thing is to remember that when the ball is in your court, it's now really in your court. And you have to realize that your body is truly your responsibility. If you can remember that before you get the surgery, you can completely avoid this scary moment when a surgery doesn't work.
About 4 weeks in, I'd hit what the surgeon and all the research online said was sort of the 4 to 6 week mark where you start to wean off crutches. When I tried to do that, immediately the same pain came back that I had before. It was the same exact pain, same exact spot, except it was worse. It was more intense, even shifting weight to the leg caused it to go off. So I stayed on crutches for 9 weeks. After I finally went off crutches, when I went in, I said, I'm not using the crutches anymore. I'm still really struggling. My leg's not right. I'm not able to do lunges, to do jumping, running, anything. I'm basically walking with a limp. That's where I'm at. I'm walking without crutches, but I'm walking with a limp. And he went over to his little recorder and said, patient has now been alleviated of pain, of the FAI impingement, and kind of said again, in 4 weeks, come back and see me. And that was based off of the range of motion. He felt that the range of motion that I had was a good range of motion, and the fact that I was walking and not using crutches marked the surgery as a successful surgery.
This story illustrates that the way a surgeon defines success is different from how you as somebody with hip pain may define success. Technically, a surgeon correcting the bone shapes was successful. But if the bone shapes are not the cause of the pain, then a successful surgery to the surgeon is a complete waste of your time and your life because you still have your hip pain. So how do you avoid being caught in this scary situation? The one thing that you need to do is start experimenting with your hips. You have to start training the hip muscles to move right and feel right. Now, we've heard from people who are already frustrated by what they've done in physical therapy or the 1 or 2 stretches they tried, and they're convinced that, well, if those exercises didn't work, my hips need surgery. And I'd caution you to slow down and really think about how many different exercises there are that you can try with your hips. If you don't know what exercises you can do with your hips, you should check out our playlist of free videos on YouTube that you'll find in the description box below. There is literally an infinite number of ways you can be moving your hips and training the muscles to work better. And I can tell you from experience that just because you've been to 1 or 2 or even 10 physical therapists, there's still stuff for you to experiment with for yourself. If you're still feeling scared about FAI and you're worried that you're going to get arthritis or your hips are just going to fall apart because you didn't get the surgery, be sure to check out the FAI research playlist and some of the videos that you'll find linked down below. If you like this video, click the like button and share it with somebody you know who's trying to avoid surgery for FAI. And if you have heard other stories about surgery for hip impingement, please leave a comment in the comment section down below so others can hear about experiences, both good and bad, that arose out of surgery for FAI. That's going to do it for this video. I hope you found it helpful and inspiring, and I hope you always remember that pain sucks. Life shouldn't.
Every time